Stony Brook Center of Excellence for Alzheimer's Disease provides services to patients with Alzheimer's and dementia. And this is a vulnerable population that is particularly at a higher risk of contracting the coronavirus and having a bad outcome if they do.
When COVID first came out, the first thing that we did was advise our patient base to stay home. We rescheduled appointments, we provided resources over the phone until we could find a venue to serve them. And then we rolled out telehealth services.
We saw the results instantaneously. We were able to see more patients, provide safer care, and be able to really help patients receive the care in their privacy of their own homes. They did not have to travel long distances to come and see us, which really increased the efficacy and reduced costs, as well as created a lot of convenience for the caregivers, as they did not have to take time away from jobs to come to see us at our center.
Some of the challenges that we came across at that time were people without a camera on their computer, or people without even a smartphone where they could access that kind of software. Typically, a family member or other care partner would be present to help them set up the platform and make sure that they could communicate and see me on the screen. We did the best that we could. If we were even able to just do a phone call with them, that was fine too. We just tried to meet them where they were at.
Never knew that telehealth can be used even for cognitive evaluation and that kind of details evaluation very successfully. So that's something, a learning experience, and I think we're going to continue for a while telehealth even in the future, because there is an amazing resources for healthcare for patients who cannot come to the provider or who have an urgent need for seeing a physician. So this is really a way of it changed our healthcare forever.
Among surveys of patients and providers, the level of satisfaction with telehealth services in psychiatry tends to be equivalent or better in some cases relative to in-person visits. And so I think this will actually allow us to access more people than we have typically been able to, particularly those who live in a remote setting.
Isolation during pandemic caused so many psychiatric symptoms, and then anxiety, panic attack. Isolation and social interaction is such a paramount thing in our life. And the other positive practical aspect of seeing patients that we learned during this pandemic is a wonderful way of connecting with patients through telehealth.
So I think that in this time of COVID, our challenge is going to be to continue that provision of care to our patient population while minimizing their risk of exposure.
It is cost effective and it's convenient. And this definitely would be the new normal in some ways moving forward.